From the vision of its founders, PPO CERV takes its first breath. An organization alive with purpose, innovation, and determination of healing a broken system.
I guess we're talking about just more than 10 years ago, period leading up to February 2015. And unfortunately, the situation hasn't really changed a huge amount, although I think we represent some of the change.
How did I manage the first beginnings? Those were amazing, humble beginnings of PPO CERV. Here I am packed with a laptop, with my router, and now heading to a doctor's practice room. You go in there first day, the practice staff, the front desk ladies, they have no idea what you're talking about. Who are you? Where are you coming from?
I'd met Brian a few times in and out of Discovery. They made a call, said they want to come and pitch something. He's one of the more interesting people that I've met, and it's one of the privileges of my job. I get to meet lots of interesting people, some as mad as hatters, but it was basically on what he said they want to do. I thought it was extremely ambitious, but also thought it was really important to test this model.
I guess when we started, we were clear that we needed ability to manage the patients effectively. And we looked around initially for systems that were off the shelf that could essentially do patient management, because we were really trying to put the patient at the center of the system. And I think at that point there was nothing that we could purchase or nothing that we could use off the shelf. And I guess one of the early big decisions in PPO CERV's, lifespan was one of we needed to build a system. So ICS was really born out of the need that we had, and I guess probably from day one that was one of the things that we set out to build.
I've been a long-time fan of universal healthcare, but I really just didn't see any way we were going to get there. And the PPO CERV model, and I think also the fact that him and Ridwan were willing to give up really well-paid executive jobs and put everything in to get this business off the ground, just seemed like the people you should get in behind. So it wasn't terribly, it took about 20 minutes to convince me, and I was in.
I have been deeply involved when it comes to this program. When I started at GEMS 2019, I started the year where we were implementing the program as the pilot. So we piloted it for 3 years, from 2019 to end 2022. So there's a lot of work that we have done between GEMS and PPO CERV. From my perspective, all I can say is, firstly, this is the first initiative in the primary healthcare space for providers to provide services to our members, to have a more of a GP-led, value-based care model.
The pilot showed, they came back and they said, we want this for all of our members nationally. We have never been so jubilant. And it was like 15 of us. And we had to go and implement this nationwide. So there was a lot of thinking, a lot of work that went into it. But again, like I said, we have an amazing team, and the people that we've attracted along the way, we're now more than 100 people. Yeah, we are very grateful for GEMS for having believed in the vision, having believed in South Africa, and given this dream hope to make it see the day, as it were.
PPO CERV was born into a world of immense challenges, but its ambition and perseverance were just as great. From the very beginning, its story unfolded with innovation as its pulse, collaboration as its lifeblood, and a steadfast vision to help heal South Africa as its guiding purpose.